Hey guys, so since we're all pretty much quarantined inside because of everything that's going on in the world, I figured we could do a story time. Particularly Lilo's story because it's had a lot of bumps. Needless to say, they say that cats have 9 lives, and Lilo has definitely used more than a few of hers. So if you clicked on this video to learn more about Lilo or more about conditions that have outcomes that aren't completely devastating, then you clicked on the right video, and I hope you give it a big thumbs up and comment down below what your experience has been with your cats. Leave the timestamps over here or over here of each roadblock that Lilo has come across in case you're interested in skipping ahead or skipping certain sections. So Lilo's story actually starts before she was even born. It starts with her mom, Tink, who we rescued and didn't realize she was pregnant at first. Fast forward several weeks after her rescue and along comes Lilo. But this is where Lilo faced her first challenge. So when Lilo was born, it wasn't a normal birth. Tink, being a first-time mom, being very small, and being a Manx cat without Manx syndrome, had difficulties within itself at all. So she doesn't have quite the muscle tone that a normal cat with a tail would have, which made contractions and pushing the kittens out more difficult for her. Lilo actually got stuck in the birth canal and her little back paw was sticking out. Now, her back leg did eventually come all the way out, but Tink wasn't able, because Lilo was a little bit bigger and Tink was so small, that she wasn't quite able to push her out all the way by herself. She got stuck in there, and I medically had to intervene and sort of help pull her as she was having contractions, which is scary in itself because sometimes you can lose kittens when they do get stuck. Her second hurdle kind of starts with her brother. So Lilo was born being stuck in the birth canal and everything went smoothly. She came out. The placenta came out and everything seemed to be okay. Then her brother was born and he came out fine. Tink was able to kind of like push him out at that point because he was a little bit smaller than Lilo, and it went a lot smoother. However, when he was born, the placenta didn't come out all the way. So it actually ripped the umbilical cord from the kitten and he ended up with an umbilical hernia. Now, it was to the point where he had protruding organs, and we immediately took him to our normal vet. At this point, the vet went ahead and put his spleen back inside, or what she thought was his spleen, because it was hard for her to tell because he was so little. And at this point, she went ahead and stitched him up, gave him oral antibiotics, and pretty much sent us on our way saying, I can't tell if there's going to be organ damage, if he'll make it, so on and so forth. Just kind of keep an eye on him and everything. So we went home and we named him Stitch. Well, if you're gonna name a cat Stitch and it's only a litter of 2 and the other one is female, you have to name her Lilo. So that's how Lilo got her name, and it was Lilo and Stitch. Well, later that day, I was feeding Tink and I noticed blood on her. And at first I thought Tink was bleeding. So I freaked out and I noticed that the source of the blood wasn't coming from her. So I automatically checked on Stitch because he had stitches, right? Maybe a stitch tore or something. So I checked on him and he seemed fine. And then I looked at Lilo. Now keep in mind, this is probably around 3 a.m. So most vets, at least in my area, other than an emergency vet, are not open. So she has now an umbilical hernia with protruding organs, and I'm freaking out because our vet isn't opened, and she didn't have this condition when she was first born. This happened about 12 hours later. We went ahead and we rushed her to the animal emergency room near us, and they basically said they had to call in this special surgeon to be able to put her organs back and stitch her up and all of this stuff. And they also thought it was her spleen, and I asked them, like, why did this happen? Like, she was fine when she was born, like she didn't have this. And their answer to me was that with Tink being a new mom, not really knowing what she was doing, like being a baby herself, like she didn't know, and she caused the umbilical hernia by continuing to chew off that umbilical cord. So Lilo got stitched up, and we took the little family back home. Unfortunately, Stitch did have internal injuries and didn't make it. However, Lilo was able to survive this. So the next thing Lilo dealt with was right around potty training time. So the time around 4 to 5 weeks when you introduce kittens to the litter box and you want them to start using it, you know, like we started to notice like she was having more accidents and stuff, and we knew that something wasn't quite right. Like we would be cuddling her and she'd be asleep, and all of a sudden she would urinate or defecate in her sleep, and we knew that this wasn't typical of a kitten her age. So we kept an eye on her, and we took her to the vet the next morning. We explained kind of like what we had observed about her and everything, and the first vet said, oh, it's okay, they're like puppies, they outgrow it, you know, they have accidents and they pee when they don't mean to, and it's just like dogs, she'll grow out of it. And I thought, well, I mean, we've had other kittens and they've definitely not behaved like this, so don't really believe you. I didn't say that, obviously, but like that's kind of what was going through my head. Then when our normal vet opened up, our normal vet at that time opened up, we went to see her, and we told her what the other vet had said. We told her like what we had observed and went through the whole spiel again, like how she was urinating and defecating on herself. She wasn't really acting normal, how she kind of like leaked all the time. And she palpated her abdomen and basically said she felt something kind of funky and wanted to do an x-ray. So we agreed, and Lilo got an x-ray. Now in this x-ray you can see that her colon is very enlarged, and she's actually missing part of her vertebrae. So she was diagnosed with Manx syndrome, which is the gene that shortens the tail, actually shortened part of her spine. So she's missing some of her vertebrae, which causes her incontinence because it causes those neurological deficits within her muscles, specifically her urinary tract and her colon. Additionally, because of her Manx syndrome, she wasn't able to properly go to the bathroom. So she developed something called megacolon, where when she's not able to alleviate her bowels appropriately, it kind of stays in there and it causes her colon to stretch. and once it stretches, it's not able to come back to its normal shape. And hers at diagnosis was about 4 to 5 times larger than it should be. At this time, I don't want to say the vet was callous, but in a way she very much so was. She didn't really talk about options as far as medication or treatment or therapy. She just kind of straight went to euthanasia. Like, it was just this normal thing. Oh, she has Manx syndrome, she's a kitten, just euthanize her. And that really struck a chord with me, and I had a lot of issues with it. And in fact, I completely rejected that, and immediately scheduled a vet visit with a specialty veterinarian who only sees cats, and actually sees a lot of special needs cats within our area. So at that appointment, we learned more about her condition. We got her on medication, lactulose and cisapride, which helps her constipation and in hopes of helping her synapses and her neurons. We learned that she doesn't have any neurological function in that area, so she has been taken off of cisapride since then, and we have learned how to express her bowels, so she also no longer needs lactulose. So she's completely off of medication now. She lives a very normal life. She doesn't know that she's any different. She does wear diapers, she is expressed, she gets butt baths and stuff. But I mean, the first vet made her genetic condition seem like a death sentence, and it's not. It's really not. And it still upsets me to this day that, like, if we had listened to that initial vet who diagnosed her with these conditions, like, she wouldn't be here. She would be gone, and we wouldn't have our sweet little baby, you know? And it blows my mind to think that while the vet might be naive to the fact, or might just be thinking that pet parents wouldn't take on that emotional, physical, and financial burden of having a special needs cat, like, vets should lay down all the options and talk about every single scenario instead of just automatically recommending euthanasia. And I'm not trying to bash anyone in the veterinary field or even that specific vet, but I do feel like as a pet parent, you should be told all your options. You shouldn't be just told that euthanasia is your only option, especially for something that isn't a death sentence. So sometime after her diagnosis of Manx syndrome, she unfortunately got a upper respiratory infection. She was put on antibiotics. Her condition wasn't getting better, her eyes weren't getting better, so we went ahead and we took her back to the vet. When she had gotten to this point, her eye was almost completely swollen shut, she needed to be seen that day. And we took her back to the vet, and the vet was looking at her eye and was like, okay, well, we're gonna go ahead and give her another round of antibiotics, and then when her upper respiratory infection clears up, we're gonna have to remove her eye. And that shocked me, that she could potentially lose her eye from an upper respiratory infection despite us following the vet's advice, having her antibiotics, her eye drops, and everything, and despite all of this effort, that she still might lose her eye. So they went ahead and they wanted to schedule it and get the prepayment and all of this done. And I was talking to my husband and I was like, well, the vet was talking about this, but like, and we of course Googled, because, you know, who doesn't Google as cat parents? I mean, we've all done it. So we went ahead and we scheduled like an emergency visit with our cat specialty doctor and had her look at Lilo. And she was like, I don't think that she will have to have surgery. Let's like put that like in the back of our mind and try these other things. And we had to do like this really gross stuff, which if you want a video on that, leave it in the comments below. I can totally have a story time about Lilo's eye treatment. But we basically did this treatment and we switched her antibiotic eye drops to afloxacin. I think that's how you say it. I'll leave it up here somewhere. And her eye cleared up like within a couple of days, which was amazing. So her Manx syndrome, she is at an increased risk of having a urinary tract infection, which she did unfortunately get, and she got really lethargic where she didn't really want to eat. Of course, it was on a Saturday, so we took her to a vet that was open. They said, you need to take her to the ER. So we immediately took her to the ER. We checked her out of that vet. We took her to the ER, and the ER did some tests and was like, she's in renal failure. Suggested euthanizing her and like really pushed to euthanize her, that like she wouldn't be okay and all of this stuff, which is understandable. But we weren't at a place where we were ready to give up, and we wanted to fight for Lilo, and that's what we did. So she was admitted into the ER. She was given fluids and medications and everything, and the vets do shifts. So when the third shift vet came in, she was actually the vet that saved one of our other kittens, which if you want that story, comment down below. But she called us and was like, hey, so the other vet caught me up to speed that we did an ultrasound and her kidneys looked abnormal. I'm seeing here that her kidney values are highly elevated, so on and so forth, and that the other vet thinks that she's in kidney failure because she's around 7 months old, which is when kidney genetic deformities start to manifest physical symptoms. And I was like, okay. She was like, but I don't necessarily agree. She went into details about how she thought that she just had a really bad urinary tract infection that caused the kidney values to increase, to show abnormalities in the ultrasound. So we were like, well, what can we expect for each of those diagnoses? Because you guys are pretty much like telling us different things at this point. Like one of you is telling us like this is a condition that like she's going to die, and the other one of you is like this is a condition that you can give like antibiotics to and she should be okay in like a couple of days. And she was like, well, let's go ahead and let's keep her on the antibiotics, see if like she gets any better, if she'll like start eating on her own and all of this. And you're like, okay. So she stayed in the hospital for another day or so, and then we got a call that like her values were starting to get better, but that she wasn't really eating and she was having a lot of issues with her blood sugar. So we drove up to the ER and we brought her favorite treat of all time, and she literally devoured it. Like They say that cats are picky, but Lilo is one of the pickiest eaters ever. Like, she would not touch any of the food at the ER, and she just devoured it. She ate like 3 meat tubes that day. We started talking about like if she was able to go home, and they were like, yeah, but her blood sugar is still like kind of an issue, but we do see that she is starting to eat. So we went ahead and we got a glucometer or a blood sugar meter from the store and got it calibrated so that we could monitor her blood sugar. And we took her home and we fed her every hour. Literally every hour, checked her blood sugar, checked her weight, and then she was doing better within a couple of days, maybe a week, if that. Lilo definitely hasn't had an easy life. I mean, that's 5 instances where she either could have died, been euthanized, or lost her eye. But despite all of these hurdles, she's lived because we've chosen to not give up on her, to get second opinions and do research and due diligence on our own. And I think that's the important takeaway from this. Like, if we had done what some of the vets had suggested or wanted us to do, like, she 100% would be dead right now. But she's not. I mean, she's living a normal life. Like, she plays and eats and roughs house and does all the kitty little things that her little heart desires. But yeah, so that was story time. That was everything that Lilo has been through, which was a lot. I hope you learned stuff. If you want more details about anything that Lilo's been through, leave it in the comments below. Like this video and don't forget to subscribe. See you later. Bye!